Week-by-week alcohol consumption in early pregnancy and spontaneous abortion risk, a prospective cohort study. Alcohol use is common in early pregnancy, though most women stop using alcohol after a positive pregnancy test. Therefore, exposure tends to be concentrated in the first weeks of gestation prior to pregnancy recognition. While alcohol use has been definitively linked to several adverse pregnancy outcomes, its relationship with spontaneous abortion, or miscarriage, is undetermined. Spontaneous abortion occurs in approximately 1 in 6 recognized pregnancies and can come at a great emotional cost. When studying alcohol use in pregnancy, it is important to consider timing of exposure. In a previous study from our group, we found that most women who used alcohol did not change their pattern of use until after they were pregnant, regardless of whether the pregnancy was planned. This change often aligned with a positive pregnancy test. In spite of this finding, alcohol is routinely treated as an unchanging exposure in the literature, which does not reflect pattern of use for most women. As a result, there is limited data on how timing and duration of use relates to spontaneous abortion risk. In this prospective cohort, we had the opportunity to recruit participants prior to pregnancy or in early gestation who reported alcohol use both before and after any change in drinking. Our primary objective was to determine the influence of week-by-week alcohol use on spontaneous abortion risk. Participants right from the start were recruited from 8 metropolitan areas in North Carolina, Tennessee, and Texas between 2000 and 2012. Median gestational age at enrollment was 47 days, and 26% of participants enrolled prior to conceiving. During the first trimester interview, participants provided detailed information about alcohol consumed in the past 4 months. This window was selected to capture alcohol exposure immediately prior to pregnancy and through the first trimester. Participants were asked about timing, frequency, amount, and type of alcohol consumed, and about the presence of binge drinking episodes. They were also asked whether they altered alcohol use during this period and date of change in use. The answers to these questions allowed us to leverage information about gestational age-specific exposure in our analysis. Let me explain why this is important. Here I have depicted 6 different women. Let's say these bars reflect their alcohol use during pregnancy. Red signifies time spent exposed to alcohol, and gray is time not exposed. In studies of alcohol use in pregnancy, it is common to ask women about their use at enrollment. Let's say that happens here. Using this approach, we only have insight about exposure at this instant in time, and miss information about exposure that may have occurred earlier in pregnancy or thereafter. Alternatively, if women were just counted as ever exposed or never exposed, we would lose information about pattern of exposure, and we would be unable to measure how timing or duration of use relates to risk. Both approaches lose information and oversimplify exposure. In this analysis, we leveraged gestational age-specific exposure data for all participants to measure how gestational week-specific exposure and duration of exposure related to risk of spontaneous abortion. 5,353 pregnant women were eligible for the analysis. Of the women eligible, 50% reported alcohol use at pregnancy onset. Median gestational age at change was 29 days, and 41% of women who changed their use reported changing within 3 days of a positive pregnancy test. 12% of pregnancies ended in spontaneous abortion. Women who were older, white, and highly educated were more likely to use alcohol than their counterparts. When considering week-specific alcohol exposure, alcohol use in gestational weeks 5 through 10 were associated with spontaneous abortion after adjusting for multiple comparisons. Risk peaked for exposure in week 9 of gestation. Results were consistent when excluding participants who reported binge drinking and when the model was further adjusted for illicit drug use. When considering duration of exposure, we found that each additional week of alcohol use was associated with an 8% relative increase in risk of spontaneous abortion compared to women who did not drink. In other words, participants who were exposed to alcohol use up until 29 days of gestation, the median gestational age of alcohol use cessation in this cohort, had a 37% greater risk of spontaneous abortion relative to participants who were unexposed. Alcohol use in the lowest exposure category, less than 1 drink per week, was associated with elevated risk in a way that was not different than estimates for higher levels of exposure. Estimates did not vary by alcohol type. In this prospective community-recruited cohort, alcohol use occurred in half of pregnancies, with many participants not changing use until after a positive pregnancy test. We found that timing of alcohol use is a key determinant of spontaneous abortion risk. Each additional week of alcohol use in the first trimester was associated with an 8% cumulative increase in risk of spontaneous abortion, even at low levels of consumption. Alcohol use prior to pregnancy detection is common in both planned and unplanned pregnancies, though most women stop or reduce alcohol consumption after a positive pregnancy test. We found that alcohol use in weeks 5 through 10 of pregnancy are most concerning for risk. Since home pregnancy testing reliably detects pregnancy as early as 4 weeks of gestation, there is a window of opportunity. These results promote a clear and actionable message. If you are planning a pregnancy or could be pregnant, test early and make a change.